programs and cures at Packard Children's Hospital. And we also, I hope some of you were able to attend the town hall that I did a couple weeks ago with about 150 folks on the hospital to help the staff and the managers, everyone within the Children's Hospital, know that research touches everything that we do in the hospital. And obviously everybody knows how incredibly important it is for the School of Medicine. And we will hear from Ruth O'Hara, the Senior Associate Dean of Research. I want to keep my remarks fairly brief. I just want to ground us out all right now as we think about the mission and the vision of the Children's Hospital. You can see that science and breakthrough discoveries are front and center. And obviously it's so foundational to everything. Oh, there's Ruth. I thought I saw Ruth. There's everything that goes on within the School of Medicine, and our CTSA and research obviously is a huge part of what we do, but it is very much part of what goes on within the hospital. When Paul King first got here, I wanted him, the CEO, I wanted him to understand how many stunning breakthrough discoveries in child health had happened here at Lucile Packard Children's Hospital. And he gave a whole presentation on our many accomplishments in research. And then at the town hall, I highlighted just a few incredible things that go on in our hospital. So, you know, David Maahs is over here. Bruce Buckingham was really the person behind getting FDA approval for the continuous glucose monitors. That was an extraordinary breakthrough that really happened because of the folks here at Stanford. The big announcement in February that there now is a drug for food allergies, omalizumab, that was research that was pioneered here. Ventricular assist devices, the little teeniest ventricular assist devices for babies, that was pioneered here. We could go on and on and on with the kinds of examples. At the town hall, I talked about the MRI coils that have been developed for use in small children. Obviously, the incredible breakthrough discoveries in cancer and CAR T. So we just have so much to be really, really proud about. And what we're really focused on here today, the overarching theme, is how do we make it easier for all of you to do that work? So very briefly, MCHRI is the innovation engine of Lucile Packard Children's Hospital. We have 3 broad domains of institutional support. We give out lots of grants. I hope many of you have been the recipients. Here today, a huge focus is on infrastructure and education. And then we have a really deep and abiding commitment to DEI, health equity, and community engagement that we hope permeates all 3 of these domains. This is a little bit about what we do. You're going to hear more from people about what we do, and really you're here to learn about what we do. Lots and lots of grants, many different kinds of grants. They're just listed here. And then really it's the infrastructure that has been built out to a huge degree over the last 5 years. The Clinical Research Support Office, which you'll hear about, just celebrates its 5-year anniversary. Mary Chen and the Clinical Research Coordinator Services have been around for years. We have a really unique partnership with the Quantitative Sciences Unit. So if you need any biostatistics or data management support, that's available to you as an MCHRI member. The novel D3 Drug and Device Development Program. And then another thing is, when I gave talks to the hospital about all the research that's going on, I said one place where we have a real gap is in community engagement. The Clinical Research Support Office and many of the people you're going to meet here are brilliant if you are doing research on a child who has a medical record number of the Lucile Packard Children's Hospital. But if you are trying to do research on a child who is out in the community, who is not one of our patients, who would never encounter our healthcare system, and you need support, we really found that that was a big gap. And that's something the Office of Community Engaged Research has tackled head on. And then Recruitment Enhancement Corps. And then lots and lots of really novel education programs shown here. This slide, I think, really sort of sums it up in that the job of the Clinical Research Support Office is to cut the red tape. It's really about helping you excel. It's about accelerating the discoveries, or something spectacular that was discovered at the bedside, and you want to accelerate getting it to the patient. And the CRSO is cutting the red tape. And Allison Falwell, when she was new in the role, did one-on-one interviews with well over 100 faculty and created this stunning fishbone diagram of all the problems, and they were vast. And as you'll hear, as you'll learn, has really done an extraordinary job. But here's the quote: "I have found the obstacles to initiating clinical research at Stanford to be daunting, and at times refrain from starting important early studies due to limitations on my time. These services and resources have made a big difference." And that's really what it's all about. The other thing we do, I think, is really, really unique, is MCHRI is very intentional in trying to push the maternal and child health research agenda across this entire campus. There are spectacular, brilliant scientists doing stuff across the entire campus and not asking themselves, what's the maternal and child health relevance? So we really incentivize that. We give out $200,000 grants specifically for our faculty to partner with faculty in other schools. And we now have MCHRI funded partnerships and collaborations with every single one of the schools on campus. And just in the most recent round, we finally funded something through the climate to the School of Sustainability. So now we officially can say we have partnerships with every single school, all the institutes, and then many, many different centers and programs across the university. That's a huge part of what we do. When we talked about when we've been talking about the need to continue to bolster this support for our faculty, we were doing sort of a workshop at the foundation around fundraising in this area. And we had a graphic artist who was making a design while we were talking. And this is what she created. And it was about what are all the things that we do to recruit and retain A+ faculty. And I will tell you, this kind of support is incredibly powerful. When I am trying to get a really preeminent scientist to come join us here, and I explain that this exists, you can just see the relief on their face about how they're going to be able to bring their research here and not lose momentum. And then also, I think it's really important for the retention of our faculty as well. So this is a fun graphic that we're actually going to have framed and hung up in CAM. By the numbers, I know there's been slides that have been flipping through as we all came together here, but the numbers are really impressive in terms of the amount of grant funding we've given out, the number of awards we've given out, and really, really exciting is that we have, I'm sure the numbers probably have gone up today, approaching 1,300 members of the Maternal and Child Health Research Institute across the campus. And then just the last thing I want to make sure everyone knows about is our annual symposium. We use this symposium as a way of convening the maternal and child health community across the entire campus, but we also have another really critical agenda when we pick the symposium topic. We try to pick something really hard, a really hard topic, like last year was climate. Each year we pick a really hard topic, and then we not only have the Maternal and Child Health Research Institute symposium, but we have the guest speakers meet the day before with the dean, with the senior associate dean, with the chairman of the board of the hospital, with the CEO of the foundation. I think one of the most spectacular ones was 2 years ago when we talked about how much work we had to do in community engaged and community powered research. We had the director from Robert Wood Johnson, from the National Institute of Minority Health and Health Disparities, from PCORI. I mean, we had leadership from these incredible entities on this campus meeting with our institutional leaders to talk about how to drive that agenda. So, oops, did I just bump this? So this year, another difficult topic is information and disinformation. So we do pick really weighty topics. The last thing I just want to say is how much I want to thank the education committee, because they are the group that puts this together, and it's very multidisciplinary, multiple departments. So I want to thank Tony Oro, Baraka Floyd, Natalia Gomez-Ospina, Kelly Mahaney, Kara Meister, Trung Pham, Ryan Pedrez, Christina Ticey, and Bo Yu. And this is faculty from neurosurgery, ENT, obstetrics. And then the other thing I want to do is thank the Maternal and Child Health Research Institute Executive Committee. I have the privilege of serving as director. Tony Oro and David Stevenson are co-directors. And the Executive Committee also touches many departments. It includes Rosa Paquetta, Karthik Balakrishnan, David Camarillo, Elizabeth Egan, Paul Fisher, Ian Gottlieb, Karl Sylvester, and Virginia Wynn. Virginia gets the credit for the fact that we changed our name. We were the Child Health Research Institute when I assumed this role. And when we made our logo, Virginia said, well, at least the mom's in the logo. And we said, let's change our name. And we changed our name that very day. So obviously, I know we have very many people to thank. So I am going to welcome Rick to come join us. I'll tell you, when I first met Rick in person, when I interviewed Rick as part of the search committee for the COO, I asked him specifically, how do you promote research at your current institution? He described a governance model where the hospital operation teams were involved with research. And that really was the basis for, I think, the key to our success is that the governance of the Clinical Research Support Office includes Rick, includes Jesus, the Chief Nursing Officer, includes a lot of the hospital leadership, what has made all of this partnership so successful. So welcome, Rick. Thank you.
Thank you, Mary. So it is my privilege to be here today, and I'm sorry that you can't sit down in the back of the room, but I am so happy that it's standing room only in here. I think this is really, I have prepared remarks, and I'll probably go a little bit off of them, because honestly, I'm blown away by the number of people who are in the room. We're all involved in research. I think that one of the things we've really worked very hard to do is to help everyone in throughout the hospital understand that research isn't something that just happens in a medical school building somewhere on campus, but it happens with our patients every single day. And it actually impacts all of our patients. I mean, the research that we've done, the examples that Mary has given, the examples we've shared before, research is so core to what we do. You know, we have a very loud echo in the community, and a very loud echo nationally and internationally because of that. One of the big reasons for that echo, I would be absolutely remiss if I didn't call out Allison Falwell, as Mary did. Allison is the engine that could. Allison is making this go every single day. She's supporting all of us and really making sure that we can do what we do best together. So I did want to thank her. We all play a big role in the research enterprise. I think you being here today is a statement for that. And it's really, really core to who we are as Stanford Medicine Children's Health. It's core to our strategic aspiration. I've got just one slide, and you can't read it. It's far too small, but that is our new strategic plan, approved by the board last Thursday. I'm going to ask Ben Elkins if he can read the first line. We'll actually do some town halls really going over this. The thing that I want to read to you though is our strategic aspiration, which is new for us as an organization. So here we go. Our long-term plan for Stanford Medicine Children's Health is to be the market-leading academic health center for children, mothers, and expectant families by equitably and thoughtfully providing a diversified portfolio of clinical services through the dedicated efforts of an engaged team of providers, staff, and trainees in a financially sustainable model. So that's a lot of words, 42 words, in fact. We take about 54 pages to describe those 42 words and how we bring that to life using 5 strategic goals. Research is mentioned 53 times on those 52 pages. It's mentioned throughout the entire document, where we're talking about our digital transformation and using research to create new ways to do research and to take care of our patients. In the role that our academic mission partnership with Stanford University is really the first thing that we talk about in our strategic plan. How we use our research at the bedside, right? And how we get it to our patients as soon as possible to take care of kids, to inspire our donors, and to inspire new researchers to come into our organization. That's the second little graphic is a virtuous cycle or circle. I looked it up. It can actually be both. But if you think about research is the first part of that, you can tell the story a whole bunch of different ways. The way I like to tell it is once you have an organization that's known for research, what happens, right? People want to come to that organization and patients come to that organization. And it creates this just self-perpetuating cycle that's very, very positive. And it attracts a lot of donor interest. I was talking about it with our foundation yesterday about some things that we're trying to get some donors to contribute to. Some of them are not very interesting, honestly. They're just not. And I was very honest. I don't know how I'm going to have success getting the donors excited about equipment we need in sterile processing, right? But when you talk to the donors about the amazing work that our researchers do that ends up at the bedside, they just light up, right? When you see David or Alicia or others in front of our donors and realize their generosity actually results in kids here and throughout the world getting great care, it's a circle that just keeps giving. And the last story that I want to tell is really personal to me. That's my daughter, Audrey. She's 16 years old. She's generally a good kid, very, very good student. She's the youngest of 4 daughters, and I have a son who follows her. So I'm used to, the teenage years where your kids don't really care about you. They don't like you all that much. But some of you in this room have actually taken care of her. And she's a wonderful, wonderful kid, actually, a great student and a really good athlete. If I wanted to impress you, I'd tell you her freshman year, she tried out for the varsity softball team and made it despite the fact she never played softball, which is a true statement. It's a bigger statement about the softball team, which is a relatively new program in her school. And what we found is Audrey wasn't really great at anything in softball except getting hit in the head with balls at practice, right? So 3 times concussions, and we had to get her into her care journey. So she saw adolescent medicine, she saw sports medicine, and then had the good fortune to get in a research study where they found out that she has the study was on eye movement among adolescents who've had a concussion. They found out that she's got a visual processing disorder. And it doesn't matter so much for her softball career because she's not great at softball, but she's actually a pretty good my son is soccer. She's a pretty good basketball player who really, really wants to play varsity basketball next year. And if you have a visual processing disorder, when you shoot the ball, it's a little bit harder than it is for those of us who don't have it. So she got into that study, she got into treatment for that, and hopefully next year she'll be playing varsity basketball. And so that's the last thing that I want to share with you about why it's important for our research mission here. It's because, you know, one of the things that Mary showed, that picture, the wonderful picture that the artist did at the foundation retreat, one of the things the donors said at that retreat is, we like research because it gets kids back to being kids. So the work that we get to do gets kids like Audrey back to being kids. And so that's why I'm honored to help to contribute. I was glad when Mary asked me the question in the interview. I gave a good enough answer to be standing in front of you, and I'm just very fortunate that not only me, but more importantly, all of you are interested enough, excited enough, inspired enough to give of your time at work to this important part of our mission. So I think with that, I'm turning things over to Ruth. Is that right? Or to Karl? Okay. Thank you all.
Good afternoon or good morning, everyone. I'm a little bit discombobulated. I was in the operating room. So yes, tell me what I'm supposed to do. I think okay. Sure. Thanks. Okay. Yeah. So I think I know most of you. My name is Karl Sylvester. I'm a professor of surgery and pediatrics. I was just in the operating room doing an emergency, and Mary Leonard, of course, was more than a stand-in. I was going to make some introductory comments to launch the day this morning. But in lieu of that, what I think I would just say is to kind of bring us together around a concept. The name of today's gathering is community research. And by community, as we were organizing and thinking about this, what we had in mind was all of you. So the community of children's health, Stanford Medicine Children's Health, is everybody from physician, nurse, phlebotomist, respiratory therapist, leaving no one out. And I think to echo Rick's words is this is an invitation to get involved in research. It's in our vision statement when we think about heal humanity through science. Science is the first part, and compassion, one child and family at a time. And part of the mission statement, as you know, not only extraordinary care, continual learning, and I've learned not to be late to my own appointments from now on at the podium, and breakthrough discoveries. And so breakthrough discoveries are right there along with everything else. And this is a call to arms, a call to each of you to get involved as much as possible. And that's why we've organized it the way we have. We're going to hear from several leaders. We've already heard from two. We have several more, and then we have some vignettes to talk about. But the information that's along each side here that's set up so we can continue to explore and learn about how any and all of us can get involved in research. And that's what we mean by bringing the community together at this first inaugural symposium. And so I hope you'll take that earnestly. And as Rick said, there's nothing more exciting than helping to invent the future, right? And that's really what science and research is about. So one final comment, again, while we're loading Ruth's slides, about breakthrough discoveries. So we've been debating recently, what is a breakthrough discovery and how does it become breakthrough, right? And if you think about that for a moment, all observations are important, but only several observations which have really high impact get translated. They get translated into a device, a drug, a new way of doing things, into a service. And that happens through something we call clinical and translational research. It becomes a clinical trial or something that's translational, meaning it's happening in a patient. And where does that occur? It occurs in the halls and the walls of the Children's Hospital. And that's where all of you come in, right? So we cannot do this without you. That's why it's a call to please get involved. I think you'll find very gratifying, an additional part of your careers as we all advance in this mission. And we've really seen this conversation turn towards not only strategically, but how we live this every single day. And I'm really thankful to the administration, MCHRI, and of course, a lot of the direction we take from the School of Medicine, from Dr. Ruth O'Hara's office, who we're going to hear from next. So are we ready to go? Hopefully that's enough delay. In the meantime, great. So let me introduce, there she is. Ruth O'Hara, the Senior Associate Dean of Research for the School of Medicine, a Professor of Psychiatry and Behavioral Sciences, and the Director of Spectrum. And if you don't know about Ruth and how fantastic she is, she took it upon herself and several others to rewrite the CTSA, not sure that it would get funded. And the original submission got funded, we think, we're close. And she got even a better score on the resubmission, which as it turns out, is not even going to be necessary. So
exactly. We just
Ruth,
glutton for punishment and extra
we
work.
look forward to
No
your comments.
question.
Thank you.
Yeah, that's big news for us. We're so excited. You always worry, and it does occur that when people resubmit a grant, it doesn't do as well as the first time, but we really beat the odds there and did very well. And I couldn't do it without the remarkable team. And Mchiri forms, in fact, a substantial part of the CTSA leadership. We are so fortunate to have Karl Sylvester, Grant Wells, Mary Chen, and indeed always Mary Leonard as our advocates and aligned with us as investigators on the CTSA. It's just terrific. I apologize to the lady in the back whose chair I stole and was just navigating. So I am really sorry about that. But just always grateful for the opportunity to come and talk. And I just want to say that my office, sometimes people are a little vague as to what my office actually does. And we are really there to provide support and guidance for the conduct of clinical and translational research. So really going from the basic right through to implementing in the trenches. It's one thing that I think people don't always recognize is that we think there's a pass the baton approach when it comes to translational research, that, you know, a device or a biologic or a pharmacologic comes ready-made to the patient in the hospital or in the clinical setting. And I find sometimes I have to educate my colleagues on the Senate, where I'll serve this afternoon, the academic Senate, that that's not how it is. That in fact, much of the research that we do around efficacy, effectiveness of all of our interventions actually occurs in the clinical setting. And it's a vital part of actually what we bring to our patients in the hospital and beyond. So our role is really to kind of support that and to collaborate with other entities. And Mchuri is one of our best collaborators. We really feel we're one and the same. We like to claim them as our own. Our vision going forward is to continue to expand our clinical and translational research enterprise here and across the network. And I'm going to talk a tiny bit about that. We're also very dedicated to expanding diversity and inclusion in research participation and in our workforce and among our faculty and investigators. It's critical because we are not going to reach the populations and the individuals we want to recruit into these clinical trials if we ourselves are not representative of their world, of their environment, and if we can't relate to it. We also want to increase the efficiency and rigor of Stanford School of Medicine research. That's on the table at the moment a lot. We're getting more oversight during this time period than I have ever seen. So when we come bugging you for your conflicts of interest, when we come bugging you for making sure you've turned in that IRB or added that modification, that you're really doing good work on documenting eligibility in your clinical trials, it may seem that we're going above and beyond, but we're doing so because every day a federal entity will reach out to us and ask us what we're doing in a particular space. It's critical, but it also has the value added of really making us an institution of excellence when it comes to the conduct of our clinical trials and clinical research and our translational research. And of course, last but by no means least, a place where we're entirely aligned with Mchuri and with the Department of Pediatrics is in the development of the next generation of investigators, workforce, faculty in this domain area. It's critical. And many of you may not know, when it comes to the CTSA, which shores up about 50% of the infrastructure that my office brings, it comes and is derived from actually the CTSA, which is an NIH-funded grant. The renewal gives us 7 years to actually work on that. Without the leadership of Karl, Grant, Mary, they have been stellar, and of course, Mary Leonard. We provide an awful lot of resources. We provide combined resources. We're so fortunate to have Crystal Botham, for example, be heavily engaged in providing mentorship for junior faculty, both in Mchuri and beyond, to actually bring more pediatric research to the table. And we do our own little bit of work in that domain. We have a lot of data science navigation and resources that anyone can access who is starting up a new study here so that they get some support. And that's just one example of where we work closely together, but there are many others. But the one that I just want to give a call out for today, because I think it's so important, is this notion of expanding the diversity of our research participants. You know, CTSA has a mantra: more treatments, more quickly for more people. It is essential that we recruit into our clinical trials individuals representing all sorts of different domain areas. We know that biomedical treatments work very differently in men and women in certain domains, if not most domains. We know they can work differently according to ethnic group. We know they work differently across the lifespan. We see effects at aging that we do not see in the pediatric population and vice versa. So we have to really do a huge job of making sure that we're capturing all the sources of diversity that in fact really impact how a treatment works. That's the only way we're going to get more treatments to more people. We've been very fortunate to actually expand our footprint. And one of the things that I'm most proud of in the last few years is we have brought our research enterprise to establish a full research office out at Tri-Valley that accommodates research studies led by Stanford investigators, and now coming under the umbrella of the Stanford IRB. It was autonomous for a while. We want to do more of this because it's only doing so that we'll be able to reach the individuals throughout the Bay Area that actually need as much access to our clinical trials and our translational research opportunities as the individuals who are proximal to our campus. And so we're very fortunate to have that. And this is particularly important for pediatric studies. This is very close to my own heart because my own work centers a lot on autism spectrum disorder and the range of sleep problems that individuals with autism spectrum disorder have as children. And it's really a critical domain. We're fortunate now to have a center focused on that, but we need to do so much more because all too often pediatric disorders are left on the table because it's hard to get individuals totally committed, including NIH commitment, to really supporting us. And that's why an entity like MCHURI is vital for making sure that work gets done. And pediatric samples, populations, cohorts, disorders are very much a mainstay consideration of our CTSA. So on that note, I'm going to leave you with a place where you can learn more about my office and the work we're doing, how that aligns with MCHURI, and also the work of the CTSA. We do a monthly town hall, and if you have a chance to tune in, you'll learn a lot about some of the most exciting science. You'll also learn how to get your data use agreements done, your material transfer agreements, and many other more tedious components, but it's a good source of single shopping. But I'm extremely grateful for the opportunity to come today and speak to these components, because for us, bringing more research, more clinical and translational research throughout the SHC Stanford School of Medicine networks is an essential next step. Thank you so much. And of course, LPCH, we tend to consider them in the same umbrella, but we are definitely going to be knocking on Rick's door as well. Thank you.
Thank you so much, Ruth. Yeah, as Ruth said, there was a question that came up the other night in faculty practice because she mentioned Tri-Valley and you saw the map of the network. PCHA and trying to move the affordability, meaning the ability to participate in research, into PCHA is top of mind. We'll be discussing it in the coming months and hope to be able to have some news on that in the near future. And I know that this is really important to Ruth, as demonstrated by her call out to that. Before we call up the next speaker, just another few comments. Hopefully you can see by the three senior leaders that we brought forward this morning, this is a partnership. Research does not exist, as everyone has said, in the School of Medicine. MCHRI serves as a bridge, historically very good at education and pilots, and under Mary's leadership, we've created this middle tier, which is about infrastructure, expertise, and education, which is more and more about translating. And then finally, the third critical partner at the hospital and the senior leadership at the hospital, Rick Majzun, has really embraced this. He spoke about how research is going to become increasing focus for the hospital strategy going forward, and we look forward to providing for some to-do items and some action items to fulfill that. So having said all that, let's move forward with our next speaker. Is it Kim, is correct, or is it David? Kim, where is she? Ah, there he is. Sorry, Kim. Okay, we're gonna bring up Kim Williams. She's the Director of Patient Care Services, Hematology, Oncology, CAR T, Stem Cell Transplant, Center for Definitive and Curative Medicine. And in her free time, not sure what you do with that amount of titles there, Kim.
Beautiful puppy named Sasha, Miss Sasha. Oh.
But we strategically chose Kim because she herself embraces and is involved in research on a daily basis in addition to all her other administrative tasks. And so this, again, it's about community, it's about each of you, and we're going to hear from Kim about how she's executing in this area. Thanks so much, Kim.
Absolutely, thank you. I truly am blown away by what I'm seeing here. I was almost moved to tears because everybody rose to the occasion today, and everybody in this room thought, this is important to me and I'm a part of this and I want to go see what's happening over there at the CAM. And so I want to first thank you, Mary, for inviting me. It is an honor and a privilege. It is an honor and a privilege for me to be able to stand before you today and share my perspective. And I also want to thank Mary Chin and Allison for the extraordinary job they've done here. For sure, they spent way too much time with me preparing for today. And so I'm going to have to thank you. Oh, there we go. Hey, y'all. So I'm going to talk today from a perspective of nursing operations leader. I have the honor and privilege in serving in the role of Director of Nursing Operations for the Maahs Center, and also have the privilege of seeing research firsthand from beginning to end. And when I say that, I mean how integrated every single person is from the time our patients pull up to the valet to the time they leave the hospital after they get their groundbreaking treatment. And so I want to start with a personal story. Am I amongst friends and family? Can I share something with y'all? No judgment. All right. So when I went to nursing school, I kind of went into it with a positive mindset. I was really excited I got accepted and started my journey. So got through the first year and kept hearing these horrible stories about this research class. And I thought, well, if I have to take a research class, so I need to go on down the hallway and see what other degrees are available that I can pass. So I got a mentor and made it through that research class, just hated it. Got my degree and was able to start my first job in the PICU, lifelong dream to do that. And of course, I met research again, and they were, saying you've got to be involved in this if you want to grow, if you want to be the charge nurse and all of this. Never wanted anything to do with it. And met a wonderful young lady who was at the time our director of nursing research. And she nominated me. I don't know what she was thinking, but she nominated me to be the co-chair of the Nursing Research and Evidence-Based Practice Council. And I thought, okay, so I'll show up every Tuesday, free food, we'll go to the meeting and I can promote it and all of that. Well, little did I know, I got into the first meeting and we started really diving into it. And, she said, it's not that bad. It's all about the question. Like someone asked the question and I thought, okay, I'm going to go with this. And we walked from the PICO question all the way to implementation, all the way through pre-data implementation and post-data. And I got to see what that looked like. So I was then stung by the bug and I got a real interest in that and decided that I would go back to school because she said she could help me with my research project or my evidence-based practice project. So went on to do that. And then, when you go back to school, people start asking you to do all these things because they think, oh, you're smart and you could do this. So started taking on a lot more projects, keep me honest on the time. And went back to school and got my master's. And people were saying, oh, now you need to go back and get your doctorate, or they said PhD. And I thought, okay, so this is where I draw the line. So I said, not going to do that. And knew I needed to go back to school if I wanted to grow. in my role and if I wanted to do, continue to do what I love to do. And so I chose to go for my doctorate of nursing practice. And so this is a little tidbit, free information that I'm going to share with you. What is a DNP? A doctorate of nursing practice is really, really simple, and it helps me to do both. And so basically what it is, a degree for a nursing leader that basically translates research to practice. So I get to do all of that with my research colleagues, but then I get to translate it to the front lines. And I get to figure out how we can implement things, how we can change our clinical practice, how we can support, how I can advocate for what we need. The second thing I'd like to share with you is community. I kept hearing today. It is all about community. And I'm just going to give you 2 examples of how it impacts my job and how it inspires me to make sure that my team has every single thing that they need to partner across communities, whether that's in community, out in the community, whether I walk down the hallway to the School of Medicine or to the big hospital. Community, how can we do this as a community, and how I can encourage and shine awareness on we all are involved, whether we want to be or not. And so my last story is about, and I'm going to try not to cry, but my father was diagnosed with lung cancer back in December, and stage 4 when we found it. And so I rushed to Pennsylvania and I said, oh, you're coming to Stanford. Like, you don't have a choice, you're going to Stanford. And he was happy to do so. And so we came to Stanford and started our treatment. And I knew as a nurse that it looked grim. And I shared that with him. And he said, I trust you. They wanted to do 2 chemos, 1 immunotherapy. And he said, I really, I gave you my word that I would do my best and I would try. And so I said, okay, we'll try a couple of rounds. And so we did. He got really, really sick, of course, from the couple of rounds. But before we started, we had a research assistant come in the room and say, you're going to be taking this drug, and we would love for you to participate in this research study. And my dad looked without even thinking about it. And he said, this won't help me, but if I can help somebody else, then I want to do it. And he did. And so he did 4 rounds of chemo and immunotherapy. And while it didn't help him, it bought me 4 months of the best years of my life that I got to spend with him. And he is still making a difference because he agreed to participate in that research. So from the front lines to the boardroom, we all should be advocating that we get involved, we stay involved, we promote research every chance we get. Right now, as I'm standing before you, there's a child in the Maahs infusion center that's getting a drug, a research drug, that costs $2 million, 1 dose. When that patient leaves the hospital today, we have given that patient back their life, and we've given that family back their life. And I think I better stop before I start crying. But as an operational leader, I'm committed to making sure our teams have what they need. I will promote it. I will bring awareness and educate around research. Thank you.
Wow, if that wasn't inspiration enough, Kim, thank you so much for sharing a very personal story and being so vulnerable. We really appreciate it. And that's what today is about. Couldn't say it better than you did, obviously, community and the inspiring stories that we take not only from family, but also from patients that we care for. So again, thank you, thank you. Okay, I have to collect myself. That was so inspiring. And Not a nursing leader, not an operational leader, clearly an inspirational leader. Okay, last but not least, we're going to ask David Maahs to come up. David is a professor of pediatrics and health research and policy, chief of pediatric endocrinology, associate director of the Diabetes Research Center, and associate dean of research at the School of Medicine. I've had the good fortune of collaborating with David in the last year or two around shared interests, and he's going to regale us with stories of his experience. Thank you so much, David.
Thank you. And thank you very much, Karl, Mary, everyone else, and Kim. What a wonderful presentation. Next thing I'm going to say, I have to speak before you because I don't know how anyone can follow that, but very inspiring. And thank you so much for all you're doing and for sharing that personal story. So I'm going to tell you a little bit about, maybe shift gears just a little bit about a program. Do I need this one? Thank you. And I can move around. So don't worry, there's only 5 slides. But I'm going to share a program, a research project that we've been working on, got started with an MCHRI grant. Now on. Thank you. And this got started with an MCHRI grant. I also want to thank the CRSO. Rick Majzun's been our hospital sponsor, and so many people to thank on this. But I'm going to start off, maybe you don't know what type 1 diabetes is. And so this is a picture from one of the education books we use. It's a 50-year-old book, and the Pink Panther was the coolest character 50 years ago. A lot of kids have no idea who he is, but they think he's kind of cool. So so everyone had their lunch, and you know, this is the normal physiology. You eat your food, gets into the stomach, goes into, makes it sugar going into the bloodstream. Then you need insulin to work like a bridge to get that sugar into the cells of the body. Well, if you don't have insulin because you've got type 1 diabetes, which is an autoimmune condition where immune system is attacked your pancreas and you don't make insulin, what happens is then that bridge is out. And so your sugar level gets higher and higher. Your body tries to break down fat to use it as energy. It makes acids called ketones. It makes you sick. You have your kidneys trying to get rid of that sugar. So you're peeing. You get thirsty. You're drinking. And you can't get out of that cycle. And a lot of our patients show up in the emergency room in the ICU looking like that very unhappy Pink Panther. Abstractly, it's very easy conceptually to take care of type 1 diabetes. You need to know what your blood sugar is, and then you need to give insulin back in a way that matches up to what your body needs. However, that's extremely difficult to do. And you can imagine you're not sure what your toddler is going to eat. How do you know how much insulin to give? Historically, you had to poke your finger 6 to 10 times a day. Fortunately, we've moved forward and we've got things like continuous glucose monitors. But our previous way of standard of care, and this is looking at different months, we'd have quarterly visits with patients. And this is just a depiction of what your average glucose is and what would happen. You'd have a visit, things would kind of drift in between visits, and all of a sudden you're having higher and higher blood sugars. And that really hasn't worked so well in the past. But what we put together with a big team of people is to have a program, we called it Teamwork, Targets, and Technology for Tight Control. And we get started with the continuous glucose monitor in the first 30 days. How many people have seen those advertised, Libre or Dexcom? One has Nick Jonas. I see people nodding their heads. When we started this program, people didn't know exactly what those were, but now most people, when they come in, they've heard of them. So we get started with that. The advantage of the CGM is it will read a glucose value every 5 minutes. It can be displayed. You can get an alarm if you're going high, you're going low. For a parent, that information can go up to the cloud and down to your cell phone. So if your child's off at school, spending the night, et cetera, you know what's going on. Also, then we have insulin pumps. And when you connect those to a CGM, it's called automated insulin delivery. And we've got a class now that we've protocolized that to get that started early. We're very lucky to have an exercise physiologist, PhD. So we're teaching people how to exercise with their type 1 diabetes. If you're a child, that's called playing, right? Go to the playground, playing on your soccer team, whatever you want to do. It's really important that you're able to do that, do everything else all the other children can. Also, with that information from the glucose values, we've worked with our engineering colleagues across campus and be able to put together a dashboard. I'll show you a picture of that so we can get the data in and then be able to realize who needs help in between these visits, which translates into that second picture. If we know that you're having problems, having higher sugars, lower sugars, why wait 3 months? Historically, we wouldn't know unless a family called in, but now we can detect that, not in real time, but we can detect it on a weekly review and reach out, which is better than every 3 months. We're also working with our psychologists and doing patient-reported outcomes, because having diabetes, there's a lot more to just what your sugar values are, but what's your quality of life. So what this looks like now is we start people early on a continuous glucose monitor, able to connect that to the cloud, get that data into a dashboard. Tidepool is a local nonprofit who does data aggregation, and we've worked with them. Actually founded by a father of one of our former patients. We're able to get that data then in a usable format so that our diabetes educators can look at it on the patients who need that, able to get it into the medical record, prioritize who needs help, and able to then communicate back with the family through MyChart and other ways. And that results in a lower hemoglobin A1C, which is a measure of average glucose for the past 3 months, improved time and range, or time that your glucoses are in the range we want them to be, improved quality of life, and then less lower sugars or hypoglycemia. So that's worked very well. We're also then working to translate this from being a research study into a sustainable practice. And so we're working with CRSO and many people probably in this room from hospital and billing, compliance, et cetera, so that there's a way to sustain this by billing for those reviews that we do. So this is, last slide I'll show, this is a figure from the data just showing that red line is what the data looked like before we started with the project. And this is starting at 0 months through 12 months. This axis is that A1C that I told you about. The target is to be less than 7%. And you can see that with each iteration, we've gotten progressively better with how we're doing. And we're very pleased. Priya Prahalad was the first author on a paper that's just published in Nature Medicine in the last month, which is very exciting. We went from having 28% of patients meeting the A1C target at a year to up to 64% of patients. We also have another paper by Ananta Adela showing that back to the concept of the importance of addressing any disparities. Ananta had a paper showing that everyone benefited from this program, whether you spoke English or Spanish, whether you had public insurance or private insurance, everyone benefited similarly from this program. There are still some disparities, and we need to work on those, but by introducing this program, everyone benefited from it similarly. So we're pleased about that. And again, just incredibly big team that we have of people, different researchers across the university. And also the support that we've gotten from the hospital, MCHRI has been really important, and just very appreciative of all of that. And encourage you to reach out to MCHRI and CRSO with your, I think the idea came up, it's like, we're trying to solve problems, ask questions. We thought we had a problem, and we thought we could come up with some solutions, and it looks like we're making some good progress on it. Still a lot of work to do, but the families have also really appreciated being able to have this information and this type of support. So thank you all, and wonderful to be here and see such a big room.
Yeah, great. David, thank you so much. Congratulations on the Nature Medicine paper, but more importantly, congratulations on making a real difference in your patients' lives. That's really cool. I love this story, and that's why we asked David to come and present it. This is technology, not for technology's sake, but actually being applied to solve a real problem that he and his team recognized. And so I'd love to nerd out about that for a long time, but hopefully this gets you excited, because there's endless number of opportunities. Again, everyone in the room can participate in something like this. Really briefly, while Mary and I were sitting there as David was wrapping up, she showed me her notes from December of last year, 2023, where we started to talk with Rick and others about how do we increase awareness of research and the opportunity for everybody to participate in that, and how are we going to go about that. And the brainchild was today. And that's why when we look at what the name of today is, which is Community Research Event, again, in this instance, while we very much embrace the community around us, and we need to do a much better job, as Ruth and others have spoken to, this community today is who's in the room. And that is an invitation to please spend some time, now that we're done with the speakers, get to know who else is involved, what some of the posters are speaking to, what the opportunities are for everyone everyone can be involved in this. If you are an employee or a School of Medicine employee, et cetera, this is not just about being faculty or nurse PI. So with that, please join me in thanking all of our speakers, Mary, Rick, Ruth, Kim, and David, with a round of applause. And then finally, personally, I'd like to thank the team of the CRSO, Mary Chen, Allison Falwell, Joe Thomas, Tricia Ning, and Kevin Morrison, who really kind of took this on and says, let's make it happen. They've organized everything that's you've seen in front of you, including organizing the speakers and putting together the posters, et cetera, et cetera. And they are here for you, as are all of us. So please spend some time, mingle, get to know each other, socialize, and really spend some time at some of the posters and the other information. Thanks so much for coming, and let's do this together. Cheers.